Good afternoon, everybody. Today is Friday, April 8th, 2022. My name is Scott McGann with the Falmouth Health Department. Doing our weekly COVID-19 update. Our email is health@falmouthma.gov. Our website, you just go to the falmouthma.gov website. We still have a COVID page there for you. Phone number is 508-495-7485. So we had a little bit of an increase in cases this week. We're at 4054, 29 cases for the week, 5 probables, which is almost double what we were having previously for like 3 or 4 straight weeks. So we've had an increase in cases. Might just be the ebb and flow that goes on. We'll obviously have to keep an eye on it, but we did have an increase in cases over the past week. And again, that's PCR, doesn't count the home kit. There's some factor that's much, that could be significantly higher. I'm not sure. It could be a couple times. Could be, we don't exactly know. But right now, as far as confirmed go, we have the 29 for the week. Our 14-day incidence rate jumped up. Obviously, it's going to, and it'll probably be higher again next week or slightly around the same, just because it only captures some of those 29 cases. Went up from 6.6 to 8.9, and our positivity was 2.13, jumped to 2.68. This is the chart we come up with every week. We see we had 1, 2, 3, 4, 5 weeks. We're down around 14, 15, 16, and we're at 29 for this. So not necessarily a trend yet. Who knows? It's 1 week. That doesn't necessarily mean there's something going on, significantly or not, but, there's an increase, and we'll obviously have to keep an eye on it. Curve-wise, slightly increase on our flattening the curve, and again, the tighter the numbers, the tighter the dots and the flatter the line is, the better we're doing. So that's where we are with that. State's seeing also an increase. I think last week was around 1,400. The week before was a little under 1,000. Positivity's gone up about a full percent over the last couple of weeks. It was down under 2. So, there is, if you go to the trends, you can see that in the cases in blue, you start seeing a little uptick, and then you see a little testing, you see a little bit of increase, but you don't see it pretty flat with hospitalizations and deaths. That's because it's not causing the severity, or it doesn't seem that this, when I talk about the variants, it's the BA1, we'll talk about that in a second, but it doesn't appear to necessarily be causing the hospitalizations and deaths at this point in time. If you look at the incidence rate, we're slightly above that. The state average was 14.8 for that week. We were right around 9, which some towns Barnstable County towns were below us or above us. We're sort of in the middle from the Upper Cape. If you look at Sandwich was a bit lower. Mashpee was just about the same. Barnstable was a little bit lower. So that's what our incidence rate is. It's all adjusted for population to make everybody look equal in their incidence rate, or equal comparison. Our positivity, again, was 2.38. We were 2.68, so really relatively close to what the state's looking at. And again, some towns better, some towns worse. The guidance on community level transmission, since we don't really have any state on this, we jump to the CDC. We're still in the low. Again, fewer than 200 cases per 100,000. So that would be 2.5. We're about 250,000 in the county. Then that would be more like 500 cases. We would have a low, medium, and high based on whether we have a lot of new admissions. Greater than 10 per 100,000 for a 7-day total would be the low, and then between 10 and 20 would be the medium, and high would be over 20. And percent of staffed inpatient beds occupied by COVID patients, you want to be less than 10% to be considered low. Looking to the right, we're in the low because our case rate per 100,000 for that time frame was 56.81. A little bit higher than last week, but still well below 200. 3.8 is definitely less than 10, so 3.8 per 100,000 new admissions. So, and our percent of beds are used by COVID patients is 1.2 of the total capacity, so we remain in the low category for that. We'll skip over that. And then this is an older chart. They have not updated this at the state, so it remains the same. But still, this chart just indicates that if you've been vaccinated, your likelihood of being hospitalized or worse is relatively low. And they have not updated this one. I guess last week, the same thing. As the last time they had reported this was 326. So I don't know if they're going to continue to update that. But, this was around since September, and it's always been sort of, around 1.25% to 1.75% hospitalization rate among vaccinated people, and it's always been less than 1, closer to 0.5 for deaths among cases. So less than 1%, so about 0.5%. So that's been relatively stable. So if this chart goes away, just keep in mind that I've been kind of giving you similar numbers on this. Second boosters, March 29th, the CDC expanded it. Anyone over age 50, and then the state put it on their website shortly after. Anyone over 50 and older may get a second booster at least 4 months after their first booster. Anyone 18 and older with certain medical conditions could get a second booster, and anyone 12 or older with certain medical conditions, which you can get on the website. You can mix and match. It'll be a fourth shot if you went and got an mRNA, because your first series would have been 2 doses. If it was J&J, then it would have been 1 dose would have been your vaccination, and then this would be a third shot. You'd add a booster, and then another. This would be a second booster, but your third shot. If it's mRNA, it would be your fourth. But you can mix and match if you want. So that availability. And also, as far as availability, I just had my nurse Kathy take a look at it. There was plenty of open spots right now. I think there was somewhere around 80 open spots the last time we looked. As of 4/6, that was Wednesday we looked. I think today was the same, that there are open slots. So there's no need necessarily for the health department to be running clinics when there's open spots at pharmacies and Convenient MD, the health centers, Barnstable County Health Office. The community college, I believe, is still doing it. I should double check on that, but just go on VaxFinder, whatever's open. If the county decided to run a clinic, they just put it on VaxFinder, so that's where it would be. So, as the clinics, they'll be on VaxFinder, it's the same place you've been doing it for your first booster. And right now there are open spots locally. The ones that we looked at were locally. You put in your zip code, and if you want your fourth dose, your second booster, because it wouldn't necessarily be a fourth dose. If you want your second booster, that would be where you'd go. Homebound, again, should be calling the health department. We will get on that really quickly with the VNA. So that program has been in existence since last spring. Testing, again, home kits are where most people are probably getting tested, which throws off the data of how many cases there are. But we still have it. The Cape Cod Church is not being used. Barnstable County is not, just from the lack of people going to it. The Community Health Center Cape Cod in Mashpee, if you're a patient especially, still may be doing it. They will still have the ability. Falmouth Hospital is still doing it. And then the pharmacies and Convenient MD are your main places. Convenient MD has been in CVS's and so forth, have been the major place for testing. And there's availability of home kits. So, we don't get a lot of data anymore from home. We don't get any data from home kits, and contact tracing quite isn't what it used to be. We're not into the, getting into the weeds and getting really deep in contact tracing. So, it's really sort of home help, self-care, staying out for 5 days. If your symptoms completely resolved or, substantially resolved after 5 days, you can return to society, so to speak. So, that's also on the state's website as well, what to do for quarantine and isolation. So that's kind of where we are with it. We're treating it more as a, sort of a routine disease now, lesser, we were, that real strict going after every case, full board. That's been gone for several months now. Vaccination rise, we gained 143 first, second, and booster doses. Now, when you look at the data, I keep looking at this and I see the total population, total of first doses, 28,973, which would be 97%. I think what it is, and it shows a lower booster. I think a lot of the initial boosters were thrown into the first dose, and the state really can't pull them back out, because I think it's really high to say that out of 29,992 eligible people, 5 and older, that 28,973 actually got vaccinated. So I think a lot of these are boosters, and our boosters are probably higher. We'll never know, because I think the state necessarily couldn't, especially when they're first doing boosters, I think a lot of the pharmacies tend to throw it in as the first dose, and then some of those would be counted. This is a pretty good number, though, 82% fully vaccinated. That's probably relatively close to what we are. So 8 out of 10 people have been fully vaccinated. It wouldn't be 11% of people dropping and not getting it. So I think the number is probably could be closer to like 90% one dose, 82% second dose, and then like 3 of those percent should be over with the boosters given. But I don't think there's a way to parse out that information at the state, because again, I just get this from the state's website that's posted every Thursday. So, but anyway, the numbers are accurate in terms of total doses. We gave out 143, which is better than the last couple of weeks. We're well under 100. So that's where we are with vaccinations. Again, we hit a high number quickly. It's just going to be a slow sort of process at this point. I think the booster numbers obviously will go up with the availability of the fourth dose, the second booster. We are talking about BA2 as the primary, just much like, in orange in the far left was Delta, and how quickly, right around the holidays, you turn to Omicron, which is in purple. And then as it creeps up, just as quickly as that comes, the next variant comes up and does it, and it's the sister of it, or whatever you want to say, is BA2. But BA2, just much like Omicron, is less likelihood of hospitalizations, especially those among those that are vaccinated. They're just quickly taking over away from the original Omicron. So that's kind of where we are with that. This is off the CDC's website for our region. So somewhere around 85% right now of the new cases are coming back as the BA2 version of Omicron. No, there are no mask mandates at this point in time other than public transportation. And town-owned buildings still have an advisory, but any other place we no longer have an advisory. The Board of Health took off the advisory for everyone. The Select Board, determined that they'd still kept the advisory, but didn't have the mandate, and that was done back in March. So that's where we are with that. And again, things happen, things get worse, things get more severe. We change categories, then we'll have to talk. For a recap, Falmouth case counts increased this week, but remain at green. We're not getting the hospitalizations, so we are seeing an increase. We'll keep an eye on it. Obviously, I keep doing. The health department keeps doing what they're doing. We haven't really changed a lot in terms of still look at the cases, still get on Maven, still do our thing, as does the VNA. So plenty of vaccine and testing capability. The second booster is available. And there are no mandates at this time, and you do you, and you consider it based on your individual circumstances, with the exception of travel, as far as flying or buses and things of that nature. So that's where we are for a recap. We'll keep an eye on the case counts, and I will see everybody next week. Thanks.